Hello everybody, welcome to Forever Youthful with your host Dr. Jaishree Sharad. Today we shall discuss everything about skincare in your 50s. Now the skin has gone through a lot of abuse through the ages, and this is the time it starts to rapidly degrade. The collagen and elastin fibers are sort of losing balance, they shrink and they collapse and the skin becomes less firm. The transepidermal water loss increases. The skin barrier, which is there, the lipid barrier layer, tends to degrade, and so the skin gets drier. In females, more so because of the reduction of the hormone estrogen. Males also have drier skin and more saggy skin. Wrinkles, fine lines, dilated pores, and increased pigmentation are different things that you see as you are in your 50s. Apart from this, one thing that is very common when you're in your 50s is sagging, and that's something that all genders would see. Now what happens is the bone starts to resorb, the fat tends to go, and there is no support and everything begins to sag down and you have an uneven jawline. So in your 50s, in the morning of course you cleanse and you moisturize, but you moisturize and moisturize because the skin will need more hydration. So look for ceramides, hyaluronic acid, dimethicone, mineral oil, petrolatum, vitamin E. These ingredients will actually replenish the skin and make it more hydrated. At bedtime, you have to opt for anti-aging creams which have either peptides. You can look for resveratrol, you can look for marine algae, botanicals, coffeeberry, soy, tea tree oil, curcumin, which is an anti-inflammatory. Then you have hyaluronic acid, of course, vitamin C, vitamin E, and retinol. Now when you use retinol, make sure you use a moisturizer along with it because retinol tends to dry the skin. The thicker your moisturizer, the more your skin will be hydrated. Now you can do certain treatments to keep your skin hydrated. So we can give you skin booster injections, which are nothing but tiny hyaluronic acid injections all over the skin. This can also be given for your neck as well as your arms. Microneedling with hyaluronic acid is a great way to infuse all the hyaluronic acid into the deeper layers of the skin. What happens with microneedling is it creates tiny channels into the skin, and whatever you apply penetrates almost 40 times more than just a cream application. So that's the beauty of microneedling. Then for skin tightening, you need something which boosts your collagen, which tightens the skin. And so you can opt for non-surgical radiofrequency or high-intensity focused ultrasound treatments. And then comes the role of botulinum toxin injections. This is the time when one also begins to see crow's feet, one begins to see frown lines, the platysmal bands here, these kind of bands become more prominent. They're called turkey legs or chicken legs. And then you also have horizontal lines. All these lines can be treated with tiny injections of botulinum toxin. And finally, when there is loss of volume, you can do soft tissue augmentation with the help of hyaluronic acid fillers, calcium hydroxylapatite fillers, or polyl lactic acid fillers. For more, subscribe to Forever Youthful, ask your questions and post your comments here, and don't forget to like and share our video.